Ramadan Karim to everyone. I'll say anywhere in the world, everything will go well on your end. Um, I do with another episode today. You know, whenever we go to hospital and every healthcare, anybody with work in healthcare will definitely know waiting for do. As a patient walk into your hospital or your health clinic or what wherever you do work, will definitely know say we need to do something immediately before they even tell we like what they actually wrong with them. So one of the most common thing that we can do we check what they call your vital signs. We get your blood pressure, your heart rate, your oxygen, your respiration rate, and now don't add blood sugars there and all that. So this it look normal, but now one of the most important thing in this we see them call them vital sign. Important important for the actually people that know what they go on with them. And I want to share this today in this week class. Let everybody know within are the expected vital signs we get the normal, they'll get individual based on your doctor, then can understand you. So for instance, if you go to hospital, we want let the core temperature, late temperature, they like 98.6%. But if you find you can 97.5, then they're all fine. So they can even go to 98, 99. So they will okay with like even low grade fever. Some doctors and care okay with that depending on what you present. So we want the temperature, we want not just say basically more than 97, like 97.5, and low get like then 98, 99, less than 100 for the most part. If you do more than 100, then no go begin consider so you get fever. So that's not the temperature down there. And we get the heart rate. The heart rate in the 60 to 100 in a fixing in okay. But some people based on their condition, based on their lifestyle, for instance, if they exercise, you can tend to get low heart rate. For me, some heart rate get them 54, some they did 56. So that's perfectly okay because I know say I did do a lot of running, so that they tend for like give me like a lower heart rate. Some people in heart rate can they like them 101, 105, and they're okay, no need for worry about that. But there's so many factors that will go like affect your heart rate. So we're not overly worry about when the numbers and they're off by like one or two, three, four, five. That's perfectly okay. But now you don't begin double, like you don't begin with 10, 15, 20, 30, and they tell they begin work, and they tell they begin concern about it. And that's what they talk, where they go, we they know why we need to worry about it. And the other thing we can come up, what are the talk, as you said, on the screen, we go to the called blood oxygen. We get oximetry in a small machine where they put in your finger so they tell you how much oxygen your body they get. So mostly they say 95 to 100, but that's everything will get escape route. So it can be 93 perfectly, they breathe and they don't worry about that. It can be 92 self are perfectly okay. And we get some patient there, for instance, a COPD patient. If COPD patient get 95 to 100, I can even be concerned. But if they like 88, 89, 90, 91, are okay with that. So depending on the patient in condition, we kind of worry about how the vital signs then they. But on normal basis, like we me they so, get no health condition, no asthma, no lung disease. We want a lady between 95 to 100. And mostly people without any health, lung issue, any health problem, and get between that number there. And we get the big one where they do what they call the blood pressure. The blood pressure they want 20, they want all over 180. Yes, that is just a baseline. Okay, perfectly okay, let blood pressure they 98 to 120 to 130. That's not the upper number. If the up number we are the 120, they will like the 98 to the 130. If you okay. If it is low like them 98, they get symptom. We go to the call symptomatic bradycardia, which means the blood pressure low, then you get symptom. For instance, you begin feel dizzy, they feel weak, then they concerning, which means they need to do something about your blood pressure, like come up. Then if you do like them 135, you go them early 140, then you don't begin go into the hypertension mode. And I will bring different categories them. But like I say, we get baseline vital signs, then we get individual vital signs. Some people then they 130 perfectly okay for them. Some people are within the 130, not perfectly okay for them. That your doctor will determine that, and that depend on how your body they respond when your blood pressure they like the 130. Some people are with them blood pressure they 130. The heart rate they tend for go high. It tell like they in severe hypertensive crisis. Some people and they then perfectly okay with 96, 98, then perfectly okay with that. But some people have them blood pressure, they lost it like 96 all over 60 something, then they feel dizzy. Why some people are perfectly okay. So then numbers there, and I just say baseline, we get the individual differences. And I don't see patient there with all different types of them. So lot of these are the general grade is what they use for determine possible get hypertension. Like I don't say the normal they tell you say 120 all over 80. Pre-hypertensive, which means depend near hypertension. If you do like 120 to 139, they do all the lower number, the 80 to 90, they tell you say I'm pre-hypertensive. Trust me, that's perfectly okay. Also, how they begin got look at the numbers. You see that light red to that thick red, now this is how they begin concern, overly concerned. The yellow one, yes, we can concern, they will put you on medication, but in terms of people actually begin worry for them stroke, their heart attack, na the last two red one there. When blood pressure there, now then level and above, then you need for begin concern. You need for go to hospital and you need for seek help. So you dey see the numbers them, now the thing and this. And before we go further, I just dey review the vital signs there with you. I go allow review something back. How for check your respiration rate? Basically, how you dey breathe. While they so I breathe in, count down, then in a one. So now so they check your respiration rate and your respiration rate, okay, one time. And other things are not talk about that. We want time between 12 to 18, but you can get 20, you fine. You can get 16, you fine. We not just want a less than 8. If your respiration is less than 8, they become concerned. Less than 10, not say less than 10, without no cause, they will become concerned. Then, if you did like then 25, 26 to 30 will become concerned. But this not baseline. If you do up by 1, 2, that's perfectly okay. Any lab we know for the up by 1, 2 are dimensional. But the other labs say, general labs say 1, 2, 3, perfectly okay. So let's just come with it now. We don't talk about this now. So I go able check them thing there for yourself. But basically, I'd me the advise everybody for getting look me on machine on a way I just done out there. So everybody forget blood pressure machine and yours. I recommend that one day. But if you need to get on, yeah, you can when you go to hospital, try for know your baseline, you go to a baseline, within the actually how often, what are you going to blood pressure today. And it's very important for let everybody know that one day. But let's just say like you want to check your heart rate. Heart rate, yes, you can check out for yourself. You don't need machine for that. And basically what you do, you get for know so you pulse then they we get pulses that all over your body we they use for check. And for instance, like inside this hernia, so okay, if you press against here, this is way they see you press against her, if they feel something they push your hand. So then you pulse that one day, that pulse they come up from your heart. So then they use that for check your heart rate. And your heart rate for the 60 to 100 beats per minute. So if you know how to do that one, they keep perfectly okay. And we can use stethoscope, like holding a job, we take the stethoscope, listen to the patient's heart, they will counter. Okay, counter sometime in 15 seconds, we'll do the math, we don't know what's in your heart rate. The blood pressure, there's no way you can do it manually or you use the machine. Manually back, you get for them at the field for than the other for teach you. There is no way. I think the only vital is the way they will check on your own your respiration rate and your heart rate. The other thing they all you get for need machine for get your numbers there. So basically when you go to hospital, you get for know their numbers there. And then numbers there can be concerning depending on how high they. And healthcare provider they worry about when it is extremely high. Basically, if your blood pressure dey like then 160 to then 190, 200, 220, then that need for be concerning. So when you go to hospital, this na important thing this, I will begin pay attention to the numbers there. Begin writing that wetin na my heart rate, wetin na my blood pressure. If you don't go 1, 2, 3, 4 times, write the number there, they will get a baseline. They'll be like, okay, me for the most part, my blood pressure dey between 110 to 120, between 70 to 60, the upper and the lower number. For my heart rate, they mostly for like 60 to 100 or 70 to 80. You don't get them baseline and they, for the way then they off too high, you're going to say something wrong. So this is not just vital sign review. We'll get back to what they talk about today, and this is not the first video. Let's just keep moving, okay?